And a 13-member committee has been constituted to sieve through a list of irreducible minimums presented by striking doctors during a Thursday night meeting between the government and the medics. During the grueling 7-hour meeting convened by Head of Public Service Felix Koskei, the doctors laid out 19 key issues they insisted must be addressed before they call off the strike. Koskei revealed that the 13-member committee will categorize the list of grievances and submit a report for action on solutions. KMPDU officials maintain that the strike is still on. Safin Achiangoma reports.
Thursday evening at the Kenyatta International Conference Center VVIP Lounge, Head of Public Service Felix Koskei convened what he described as court-mandated talks, bringing together, among others, CSS for health, finance, public service, labor and social protection, as well as officials from the Kenya Medical Practitioners and Dentists Union, SRC and PSC. Talks that were meant to resolve the impasse that has slowly brought the health sector to its knees due to the strike, which started on 14th of March 2024. The 7-hour meeting, however, ended without a deal for doctors to go back to work, with the parties involved reading from different scripts.
The strike is still on as we discuss those things, because as a union, we only call strikes after meeting our National Advisory Council and having a return to work formula, which we don't have.
As far as we are concerned, there are no strikes. If that's all, there are people who are not working. Those are now people who are deserting duty because the court has pronounced itself.
What initially started as a push for the immediate posting of medical interns has since morphed into a list of 19 demands laid on the table for discussion as grievances by the doctors. Key among them include perennial delayed posting and the general mismanagement of the medical internship program, immediate payment of the basic salary arrears for doctors according to the 2017-2021 CBA, a plan for employment of doctors and postgraduate training, lack of a comprehensive medical cover, poor contracts and exploitation of doctors, inadequate funding of the health sector, with counties requiring 425 billion shillings to be able to adequately meet the needs in the health sector. KMPDU Secretary General Davji Atela stated that the parties only scratched the surface in the long journey to reach a truce.
Before we actually sat down, they had not checked the real issues. That's why they considered to give the breakdown, and also we had to explain really on all these particular issues. But then we need to have maybe a sitting now to actually giving us the resolution to these things.
The medics held their hardline stance on the issue of intern doctors, a demand that the Head of Public Service Felix Koskei said is economically impractical.
Our friends, the other side, wants all the interns constituted, all the interns to be still called interns, and they want to be paid 206,000 as opposed to other interns who are being paid 25,000, 35,000 maximum. And at the same time, they want government to employ all of them at the same time. We have laid down the challenges that the country has when it comes to the fiscal situation. And we have confirmed to them that we are going to see how much we can accommodate them and how many in number are we going to uptake them.
Koskei revealed that the meeting resolved to form a 13-member committee made up of representatives from KMPDU, Council of Governors, Ministry of Health and other stakeholders involved in the negotiations. The union leaders have met the government officials several times, with little, if at all, any progress made towards ending the strike. A report by the newly formed committee is expected latest Monday next week to prescribe the best dose to treat the ailing health sector and end the agony of thousands of patients in health facilities across the country where services have been affected for a 9th day today.
Goodwill comes out of previous commitments that are actually fulfilled. And that's what we will ask from that. If we have things that are fulfilled based on our notice, they will say there's goodwill. But if out of the 19 that all promissory notes, it becomes stale. And sometimes when you get a stealth check and go deposit, it will tell you out of funds.
Safin Achieng Oma, Citizen TV.